And I'm just so thankful that Mr. Vantine has given his time for us tonight. So
Thank you.
thank
And
you.
I just want to quickly say we will be recording this call for everybody to view later.
Take it away, Mr. Vantine.
Okay, well, thank you very much for that wonderful introduction. I appreciate that. So first things first, let's make sure I can share my screen here with you. Can you all see that right there? I see a lot of nodding heads, so I'll take that as a yes. I'm assuming everybody's on mute except for me. So let's get this from the beginning. Maybe we'll get it from the beginning. There we go. Well, again, I appreciate you inviting me over this afternoon to do a presentation. I really want to focus on the importance of flu vaccination, especially during this time with COVID-19 circulating not only here in the United States, but throughout the world. I'm sure there isn't one person out there in our audience this afternoon that hasn't been affected in one way or the other, whether you're under stay-at-home orders or you know somebody that's taken ill from COVID, or God forbid that you've experienced the death in the family from COVID. So my condolences for those of you that have, but let's keep in mind that while COVID is out there and gets a lot of media press, influenza is still out there and has been with us every year. It first made hallmark back in 1918 with the Spanish flu. Somebody asked me the other day if I was old enough to remember the Spanish flu. And even though I just celebrated my 63rd birthday, I had to tell them, no, unfortunately, I was not around for that. So without further ado, why don't we go ahead and get started? I'm going to talk a little bit about influenza and flu immunization recommendations. The impact of influenza on childcare settings, since that's the audience that we're speaking with this afternoon, I want to make sure that we spend a little bit of time on that. What has COVID-19 done to the vaccination rates, not only here in California, but throughout the country? So we're going to talk a little bit about that. As we mentioned previously in the introduction, talk about the importance of flu vaccination during the pandemic. And for those of you that work with parents, which I'm sure a lot of you do, and other childcare providers, some key messaging so that you will be able to talk with your parents and other childcare providers. And then I always close out with some vaccine resources. One of the questions that had come up, actually a couple of the questions that I got in the email was, are there resources available? I wish you could see my resource page that I keep on my laptop here in my offsite workstation. I probably have 4 or 5 pages of resources, not only for influenza information, but of course for COVID-19. So what is flu? We hear about this all the time. Flu is, of course, a very contagious upper respiratory infection. One of my pet peeves as a nurse and as an educator is I hear people say, oh, well, they have the tummy flu. The only way they got anything from in the tummy was probably from one of those nasty little bugs like AGE or one of the many others that are out there that cause your stomach to be upset. Generally speaking, and we'll get into that in just a minute, influenza does not cause you to have an upset stomach unless, of course, you're a little kid. And what do little kids do? They inhale all the boogers and they go down in their tummy, and that is what upsets their stomach, not necessarily the flu virus. The bad thing about influenza is it can cause pneumonia, hospitalizations. We have tens of thousands of hospitalizations every year. I have a couple of graphics in a few minutes I'll share with you. And unfortunately, what a lot of us seem to forget is that influenza can also cause death. So one of the major challenges in public health over the last year with COVID co-circulating, is we have to be able to distinguish, did they pass from influenza or did they pass from COVID? So one thing that I talk about every year during flu season is who is supposed to get the flu vaccine? This is a really easy one. The recommendations changed about 10 years ago. Basically, anybody and everybody that's 6 months, not 6 years, but 6 months of age and older that don't have any contraindications to receiving the flu vaccine. So that includes most of us that are on this line, hopefully all of us that are on this line. One thing that I recently became a grandfather, and we had this discussion with my daughter about making sure that she got her flu vaccine as soon as it became available, even though she was pregnant, because once a mom that is pregnant receives a flu vaccine, and of course we can't forget Tdap, because we want the mom and the baby to be protected from pertussis. They get both of those shots on one of their visits, Tdap in the 3rd trimester, by the way. So they get that. The mom creates antibodies. Those are the things that are in your body that help fight off disease. The nice thing about flu vaccine and Tdap vaccine is it is passed to the infant, excuse me, to the baby in utero. So the baby gets incidental protection just because mom went out and got her shots. So both mom and baby are protected from influenza and pertussis. So some folks are at greater risk for complications. If you've been following the news for COVID, some of these might sound familiar. Pregnant women, of course, are at risk because they're pregnant and they're more susceptible to a lot of the diseases that are going on out there. Older adults, 65 and above, pardon me, children under the age of 5 years. For those of you that, and obviously most of you, or if not all of you, work in childcare settings, so a lot of your clients that you deal with are in that age demographic. They are more susceptible. And if we just stop and take a second, I was in a nursery with a friend, a preschool setting. I was corrected on that the other day, so I don't want to date myself too much here. But if we go into a preschool setting, the first thing you do is you look around at all the little kids and what's going on with all those little kids. They all have green booger noses, right? And they're all taking the back of their hand and doing one of these things, and then they grab doorknobs, and yeah, I know, kind of nasty, but it's the reality of the situation. One of the things that's been kind of interesting with COVID and a lot of the education, especially about hand washing and wearing a mask, is you don't see quite as many green snotty noses as you do with little kids, which is kind of nice because we've helped reduce the amount of disease. Some people with chronic medical conditions like diabetes, asthma, heart disease, lung diseases like COPD, emphysema, they are definitely more susceptible, and we want to make sure that they get their flu vaccine. African Americans, Latinx, and Native American populations, they are disproportionately affected by chronic medical conditions. If you think about it, I worked in the Native American Health Center off and on throughout my career, and it's always amazed me the higher percentage of Native Americans that come into the clinics, and they have some of the comorbidity that we just talked about, the diabetes, the upper respiratory infections like COPD and emphysema. So these diseases also put folks at serious risk for COVID illness. So we want to protect them. And then essential workers who work outside their homes with other people and in the public. And if you think about that, in a child care setting, you're all exposed to not only the little kids, but you're exposed to their parents. And we go out and we go grocery shopping because we still have to be able to put food on the table. So just about every place that we go, we're exposed to other individuals who might be infected with influenza or coronavirus, COVID. So we want to make sure that we protect ourselves. So who should get a flu shot? When do you get a flu shot? You get it now. We started vaccinating back in October, just as soon as the flu vaccine became available. We started vaccinating our older adult population, 65 and above. We also want to make sure that children 6 months to 8 years old, if they're vaccine naive, they may get 2 doses about 4 weeks apart, and depending on the type of vaccine, they'll either get 0.25 or 0.5 cc, so a quarter of a cc or half a cc. They want to get that first dose just as soon as possible, so hopefully we can get that second dose in by the end of October. And what month are we in right now? heaven forbid, we're in January, almost to the end of January, and there are still a lot of kids out there and adults, unfortunately, who have not received their flu vaccine. So older adults, it's never too early to get the flu vaccine. One of the reasons I know that when flu vaccine has hit the market is my mom, God bless her, is she calls me up as soon as she gets her flu vaccine every year to let me know that she got her flu vaccine. And when she figured out the difference between trivalent and quadrivalent vaccine, she was very proud when she went into her local Walgreens pharmacy to receive her vaccine and informed them that she wanted the quad vaccine, not that trivalent stuff. She wanted the quad vaccine. Might have something to do with the fact that her son's in public health. Thing to keep in mind is this is the time of the year when we see that flu usually peaks between December and February. So where flu season starts to ramp up as early as September and October, we don't see the majority of cases until this time of the year. So if you haven't been vaccinated for flu vaccine, get out there, get your flu shot. You need it. So what about the impact of flu on childcare settings? Children and childcare providers are at increased risk for contracting flu just because of the group setting. If you think about the typical childcare setting, how many kids are in the childcare setting? Now, this is something y'all probably know better than I would because I haven't been into a childcare setting since COVID had kicked off and reared its ugly little head. But if you've got more than a handful of kids in there, they're all sharing germs. I think about when your kids were really, really little. For those of you that don't have kids in the childcare setting, I remember when our kids were little and they went into kindergarten, it seemed like they were pretty healthy up until they went into kindergarten. But as soon as they got into that group setting where there was 25 or 30 kids in the classroom, every time you turn around, they come home and they've got a green booger nose and they are sick with something that they picked up there. Children under 5, especially those that are younger than 2, are at higher risk for developing flu-related complications. So we want to make sure that they get that flu shot so that we can stop and help prevent the complications that are associated with influenza. Since 2010, flu-related hospitalizations among younger children than 5, so kids younger than 5 years of old, have ranged between 7,000 and 26,000 per year that are hospitalized, a staggering number. And if you think about the number of kids, and I'm sure Dr. Spinazzi is going to cover this in her presentation and when I'm done speaking, if you think about that, COVID-19 fortunately has not impacted little kids as much as influenza have. We see COVID-19 impacting an entirely different age demographic between 18 and 65 years of age. So something to keep in mind. And of course, the best way to protect against flu and its complications is for kids and adults. Everybody that's 6 months and above, go out and get a flu shot. Childcare staff, and this is something that was kind of new to me until we started putting together the presentation for y'all for this evening. And I knew you were supposed to get a flu vaccine, and I kind of knew that you're supposed to get a Tdap vaccine so we could cover you for whooping cough, because we don't want you to catch whooping cough and spread that on to your clients in that age group, but also a measles vaccine. So there's at least 3 vaccines that you should be getting. Anytime you have questions about what kind of vaccines that you need, you have 2 wonderful resources, and I'll share those in the resource page at the end of this presentation. But I did want to mention that you can go to Shots for School, which is a wonderful website. If you type it into the Google search engine, not the Yahoo search engine, but the Google search engine, one of the few times I'll specifically mention Google. But if you type it into the Google search engine, it pops up Shots for School. It gives you a direct link. It does not give you an ad link, because a lot of times you search for something in Google and it gives you an advertisement that they want you to look at. So something to keep in mind. The other thing, of course, is you can go to the CDC's website, which is www.cdc.gov/vaccines. And it gives you a breakdown by age of what some of the recommended vaccines are, not only for little kids, adolescents, and young adults, but for all the rest of us. I get this question a lot, especially during COVID. And I am here to tell you that the immunization requirements for childcare and school entry, pardon me one second. You're my third talk today, so I'm getting a little dry. Immunization requirements, especially for childcare and school entry, have not changed for the 2020-2021 school year. Immunizations are still required for childcare and pre-K, kindergarten, and 7th grade. And if you go to Shots for School, and there's the link right down there on the bottom, you can get all that information that tells you what immunizations are required by age. So, what's the impact? How much illness do we see in an average year? Now, this is the most recent data that I was able to obtain from the CDC, and these are estimates because we have to be able to differentiate during this particular season between COVID and influenza. But from October of 2019 through April of this year, we've seen somewhere between 39 and 56 million flu illnesses. That's an incredible number. There's only 340 million people in the United States, so that makes about 1/6 of the population, 1/7 of the population. 1 out of 7 people has experienced some kind of flu illness. It constitutes somewhere between 18 and 26 million flu visits that are related to medical visits. And hospitalizations, we hear about all the numbers for hospitalizations for COVID, but somewhere between 500,000 and 750,000 of hospitalizations that are related to flu. And unfortunately, somewhere between 24,000 and 62,000 deaths are attributed to flu in this season. I get a lot of questions about what's the overall effectiveness of flu vaccine. The current flu vaccine that's out there has an efficacy, we like to say has an efficacy of about 39%. And some folks, the media jumps on that and says, how come it can't be more effective than 39%? I like to look at it as I am 39% less likely to catch influenza than I am to get it. So the sad thing is when we look at the overall coverage, this is all age demographics from birth all the way up until our older population in their 80s and 90s is only about 52%. So our younger population, our kids, they're a little bit better vaccinated because they go in for periodic routine pediatric exams at the pediatrician's office at 2 months, 4 months, 6 months, 12 to 15 months and prior to kindergarten entry. After they get into school, they seem to kind of taper off in their visits. Catching up with them, especially younger kids and adolescents and teenagers, is a real challenge to get them in to make sure that they maintain their vaccinations. But also, once we become young adults and get into our adulthood, unless we have jobs that are related to healthcare and there's mandatory immunizations of some sort, kind of fall off to the wayside. Can't tell you how often I still hear my colleagues in hospital settings or clinical settings that they're not going to get the flu vaccine because every time they get the flu vaccine, they get sick from the flu, and nothing could be further from the truth. They got the flu because they probably had it before, or the mild achiness and headache and general malaise that they're having could be a mild systemic reaction to the flu vaccine itself. There is nothing alive in a flu vaccine to actually give you the flu. So the nice thing is, if we look at some of the other statistics that we've got, receiving the flu vaccine prevented about 7.5 million illnesses and somewhere between 6 and 6,500, so between 6,000 and 6,500 deaths in this last flu season. Why are flu vaccines so critical this season? You hear a lot of, not necessarily media hype, but you hear a lot of information coming out from the state health department or local county jurisdictions. Get your flu vaccine. What was the major reason that we went back on lockdown? It was because we stressed the healthcare system. There weren't enough ICU beds to go around. Not necessarily that there weren't enough ICU beds, but there weren't enough nurses to take care of those patients in those ICU beds. So if you had your flu shot and you come into the emergency department and you have upper respiratory type symptoms, they'll do a screening test on you to find out whether you've got COVID or whether you have influenza. But if you got the flu shot, we can lessen the impact by some of those numbers that we saw earlier. So tens of thousands of people may not be going into the hospital emergency department for severe upper respiratory symptoms simply because they got their flu shot. Now, one thing that's a little bit confusing for a lot of people, including a lot of folks in healthcare, is the symptoms for flu and COVID are very, very similar. So I had a friend that went to the emergency department over at Kaiser near me a couple of weeks back, and the first thing they did was what? They screened for COVID. They wanted to make sure that they weren't currently ill with coronavirus. So they went ahead and they did a screening test on those. For those that are working outside the home, this could mean missing work until it's okay to go back. So if you get an upper respiratory infection and you're not sure, it's better to be screened and check with your provider, see if they think that you need to be screened for COVID or flu or both based on the symptoms that you present with. Patients that are infected with both flu and COVID, there can be a co-infection going on, which really confuses the issue, and that puts a higher impact on our healthcare system, which is unfortunate because our healthcare system is already stressed. Adults are at high risk for severe flu illness. They're also at high risk for severe COVID-19 illness. And flu vaccination, I'm sure in your area that you live, depending on where you live in the Central Valley, you've heard about drive-up flu clinics or mass vaccination clinics for influenza. And now that we're starting to get the COVID vaccine out into the general public, you've heard about walk-in clinics. It is because of the information that we have developed, the plans that we have developed for mass vaccination for influenza, that we are able to do mass vaccination clinics for COVID. Like we mentioned earlier, if you think about it, somebody's got influenza, they're going to have a cough, shortness of breath. They may have difficulty breathing because they've got a lot of fluid on their lungs. They're going to have fever and chills. They may have muscles and body aches. They could have vomiting or diarrhea from one of the reasons that we mentioned earlier, especially the vomiting and the diarrhea in little kids doesn't really happen too much with influenza unless they're inhaling and or ingesting some of the mucus. So these symptoms are very, 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 very similar. So it's a challenge for our practitioners to be able to differentiate between the two. Interesting thing about COVID-19, it's like a lot of other viruses. Many that are infected, and I'm sure you've heard some of this on the news, they throw those numbers up there. They've got so many million people that have tested. Well, I think it's over 1 million people have tested positive for COVID here in California, and I have those numbers in another presentation that I do. But if you think about that, there's over 1 million. How many of those folks are hospitalized, or how many people are actually stay at home sick with an upper respiratory infection that's related to COVID? Up to 40% of the people, from what we know right now, that are infected with COVID-19, they tested positive for it, have no symptoms. They're what we call asymptomatic. So here are some of those numbers. These are as of the January 25th, which was just yesterday. Globally, there's over 98 million cases of COVID and over 2 million deaths. This comes from the World Health Organization. Here in the United States, there's over 24 million cases. Almost 25% of all of the positive cases in the world are right here in the United States. Kind of scary when you stop to think about it. I was out earlier running errands, and there was a young man, probably 7 or 8 years old, coughing, sneezing, watery eyes. Could have been allergies. He wasn't wearing a mask. I had to have words with the parent and remind them that that child needed to have a mask on. And it was a challenge educating them. But if you look at some of these statistics, there's a lot of disease that's still out there. Back to the United States statistics, we've got over 400,000 deaths attributed to COVID. So we need to keep those things in mind when we're out there. That's in the United States. What about here in California? We have 3.1 million cases total. Just 27,000 were added to that number as of yesterday. Those are some pretty staggering statistics. We've had over 37,000 deaths here in California, and 328 just listed on the 25th. So how did coronavirus, COVID, impact our immunization rates? We saw an incredible drop in our immunization rates, as high as 48%, especially in our kid demographic between 0 and 18 years of age. If we look at the statistics from the California Immunization Registry between April of 2019 and April of this year, as you can see, we had over 849,000 doses in April of 2019. In April of 2020, we only were able to record 442,000 doses. So that's a heck of a drop. And the reason that that occurred is, if you think about just a few months ago, and we started lockdown, how many folks wanted to go to their provider's office? Not too many people wanted to go to the provider's office. Why? Because they were afraid that if they got there and somebody was sick, they or their children were going to pick up the disease. So something to think about. Fortunately, our providers are very astute. They've got a lot of things in place, a lot of mechanisms in place to keep their offices clean. For those of you that have been into your provider offices, you probably have noticed that they do sick visits in the afternoon and well visits in the morning, so you can take your children in. Or maybe like a provider office I was talking to just this morning, where the provider has one day of all well child checks. So they do physicals and immunizations on one day, and then the following day they do nothing but sick visits. And of course, you know, they have drop-in sick visits on the alternate days. But they try to keep them accessible. I know a lot of practices go to a lot of measures to make sure that their exam rooms and their exam tables, door handles, counters where you check in, everything's wiped down on a regular basis with antibacterial and antiviral solutions. It is safe to go to your doctor's office. We want people to go to their doctor's office, especially kids. We want them to get vaccinated. We want you to be vaccinated, especially for flu and Tdap and measles, like we mentioned earlier. Doctors' offices are taking additional steps to make their visits safe. They make sure that their staff and their patients that are 2 years of age and older, that they wear a mask. That was one of the things when I mentioned earlier that I was so frustrated when I'm out running errands to see a 7 or 8 year old running around, obviously has some kind of upper respiratory infection going on. He's running around without a mask, spreading whatever cootie he has to everybody that he comes in contact with. And if you think about the behavior of little kids, they touch their face all the time, and then they're always into something. They're touching stuff on the shelves, they're touching doorknobs, they're touching the handles on the carts. So something to think about. We already mentioned that your doctor's offices are spacing out well and sick visits, and that they disinfect the rooms between appointments. Some provider offices, I know in Berkeley and some of the offices in Oakland and some of the offices in Stockton, Modesto, Manteca, Merced, they're offering a drive-up or curbside shot appointment, so you don't even have to go into the office. So there are ways that your kids can get their immunizations, and you can get your immunizations without ever having stepped foot into a doctor's office. Now, one thing that came up, and I thought I would share that with you at this particular point, is I got a call a couple of weeks ago and wanted to know if it was possible to get a virtual immunization. No. So I got a few smiles out of that one. It was really hard for me to be professional on the phone and not chuckle, but no, you cannot get a virtual shot. It doesn't work that way. Somebody has to be there to actually administer the immunization. Health insurance benefits. Got a lot of questions about are immunizations covered by Medi-Cal or Medicare? Yes, they are. You just have to make sure that you go to an in-network provider's office, and some pharmacies are giving immunizations, which is something. Not a lot of pharmacies vaccinate kids. Some do, most don't. But make sure that you go someplace where they offer those services. Most, if not all, private insurance companies also cover flu shots. All you have to do is call your member services to find out where you need to go. If you don't have any health insurance, you can always go to Vaccines for Adults Program Finder, and I'll provide this link to those of you that are watching the presentation this afternoon so that you can check. All you have to do is click on the link and follow the instructions. I call it Stephen proof because even I can manage my way through the network and find out how it's supposed to work. There's a wonderful resource. I was looking at that this afternoon while I was doing final prep for the presentation. It's called Vaccine Finder. It helps providers that offer seasonal flu vaccine and other, helps the patients, find providers that offer seasonal flu and other immunizations. It's easy to use, step-by-step instructions. You log in, you link into the vaccinefinder.org, and this is another one of those great resources that if you just type it into Google, it should take you right to it and skip all the ads. First thing you want to know is your zip code, so you do have to know your zip code. Once you've got that entered in, just follow the steps, and it will help you find a provider who can offer the services that you need. There are flu clinics by county. If you go to your local immunization program, and every county in the state of California has an immunization coordinator. They also have an immunization program. So all you have to do is contact your local county health department and look in the resource page that they have or the telephone book. I know there are some of you on the phone that know what a telephone book is, and there are some of you that have never even heard of a telephone book. So if you go to Google and you type in the county that you're in and you type in the immunization program, it will give you the link. It's very good information. One nice thing about a smartphone is just about everybody has a smartphone, except for my recently passed father who had a flip phone up until the day he died. So what are some of the key messages for parents that are out there? You know, as California reopens, and we have opened and closed off and on a lot over, it's been almost a year, it'll be a year in March. But as California reopens again, more families will be bringing their kids in for shots and child visits. The doctor's appointments are going to fill up fast. It's one of the things we noticed back in April and May earlier this year is we got a lot of phone calls wanting to know from parents if there was an alternate site that they could take their kids to. Maybe they could go to one of the immunization clinics that the county offered. So something that we can help our parents with. You can always start with a local referral with the county immunization program. They have wonderful resources. If they don't offer immunizations, they can probably connect your clients up with a federally qualified health center or a community health center that does offer immunizations. So, let's see. Another key message that came up: as a parent, I would not wait to immunize my baby. My granddaughter was actually turned 2 months just on the 23rd. So she went in and got her immunizations today. I was very proud of my daughter. And she was able to tell the doctor exactly which immunizations that my granddaughter needed. So could have something to do with the fact that dad works in immunizations and mom is also a nurse. Oh, let's see. Flu can lower your body's defenses to other infections, including COVID-19. So if you're busy fighting off the flu and you're exposed to coronavirus, COVID-19, you might wind up with both of them. And then what are you going to be doing? So if you get a flu shot, you can rule that out. Make yourself a little bit better protected, at least for influenza, until we get more COVID vaccine out there. Flu vaccines are safe and effective. They've been around for quite a while, several decades now. You can get a flu shot and it'll protect you for the strains of flu that are circulating this year. And that's a whole nother talk that I'd be more than happy to, for your next group, I can come back and we can talk about flu vaccines, give you a little bit more information. Flu vaccine helps minimize the chance that you're going to catch the flu and, God forbid, be hospitalized from complications due to the flu, or heaven forbid that you actually die from catching influenza. Childcare providers, this is targeted to y'all out there. You are around a lot of people, especially little kids, and you are more likely to catch flu and COVID-19 if you're not vaccinated. Get yourself vaccinated. Be selfish for yourself, but be also selfish for your clients that you provide childcare for. So get out there and get your flu shot. if you already haven't got it. We're already missing a lot of time away from work because of COVID. Let's not miss any time because of not having a flu vaccine and you came down with influenza. When you get back to work, and I'm assuming a lot of you are, I have colleagues that I work with that have young children, and they are in hog heaven because they can take their kids to childcare and at least work from home without kids running around. Make sure that you get a flu shot. Make sure you wear your mask anytime you're around other people, out in public, going to the bank, going to the grocery store, even at the gas station. Make sure that you've got your mask on. Use hand sanitizer. When COVID first started a year ago, there was a big rush on hand sanitizers, and it was very difficult to obtain any hand sanitizer. Now it is all over the place. When I was driving home the other day, I noticed there was a person on the corner that had masks and hand sanitizer and dial soap for sale for $1 each, which I was really impressed that they could do a little stand out there like that. California and a lot of other states that surround us are really up on making sure that we get kids and adults vaccinated for influenza because of the drop in immunization rates during the pandemic. We want to make sure that flu immunizations are promoted to minimize the impact on the healthcare system. We want to keep those hospital beds, those ICU beds for folks that are really, really sick and need to be in there, whether they have COVID or not. We want to make sure that those beds are available. So if everybody's vaccinated, or as many people as possible are vaccinated for influenza, we can help reduce the impact on the healthcare system. If you go to Don't Wait, Vaccinate campaign, which is at immunizecalifornia.org, and check out the website, there is a library of customizable social media messages and images. We can tailor messages to meet the needs of your local community. Some of the other resources that you can find, one of my favorite websites, and I work with these folks all the time, is easyiz.org. Great resource. There is tons of information, not only for influenza, but our regular childhood and adult vaccinations for the Vaccines for Adults program and the Vaccines for Children's program, both VFC and VFA. But there's also information about COVID. So tons of information out there, lots of handouts that you can use in your office, and handouts and job aids that you can share with your parents. If you can't find them and for some reason you can't download them, again, check with your local health department. Great resource. For the California Department of Public Health flu resources, you can go to easyiz.org. We already mentioned that. CDC has got some wonderful resources that are available. If you go to CDC's main website, which is www.cdc.gov/influenza, it takes you to the influenza, the flu homepage, and there is literally page after page of information and resources that are available to you. The language has been adjusted so that just about everybody can understand in the lay public and some of the individuals that you work for. Some of the information is in multiple different languages. And of course, for the healthcare providers and those of you that are in childcare, there is more technical information that is available. These are some more resources that are available on ECIZ. I like that one in the middle there. It says, babies need you, get the flu vaccine, protect yourself, protect your baby. And the one to the right of that says, guess who needs the flu vaccine? In the upper, I think it's the upper left-hand corner for you also, is a picture of a pregnant mom, which is really, really important, of course. And if you work as a volunteer, there's a poster just for you folks. For in childcare settings, you want to protect against measles, whooping cough, and flu. Protect yourself, protect our children. Don't miss work. There's no reason to miss work for getting influenza if you've been vaccinated. Thank you so much for inviting me to speak this evening. I appreciate the time that you provided for me. Whatever additional resources that you need, if you come up with something and you say, gee, it would be really cool if we had blah, 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 you can always email me. My email address is relatively simple, and I'll make sure that Trudy and Nancy have my email address to share with you. I answer questions. That's all I do is teach and present and answer questions about anything that's vaccine related and a lot of infectious diseases. My email address, as you see it right there, is stephen.vantine@cdph.ca.gov. And I even posted my alternate work number, which is my cell phone. If I don't pick up right away, it's because telemarketers are driving me crazy. But please give me a call at that number. And we'll hold questions until Dr. Spinazzi gets done with her presentation. Again, thank you very much for your time.
Thank you, Stephen. That was really informational for me as well. And we will take questions later, but over to Donna Marie to introduce our second speaker of the day.
Hi, everyone. So now we'll hear from Noemi Spinazzi. She's an MD, a primary healthcare physician at UCSF Benioff Children's Hospital in Oakland. And I am so glad to be able to present her. The staff there saved my life once, and I just have a special place in my heart for Children's Hospital. She provides primary care services within the context of federally qualified, within the context of a federally qualified healthcare center. She has a special interest in children with complex care needs and developmental disabilities. She founded a specialized clinic serving patients with trisomy 21. She works closely with California Children's Services and with the East Bay Special Needs Committee. Her work with children and families across the world motivates her to be an advocate for immigrant rights and immigrant health. She's born and raised in Milan, Italy, and moved to the United States when she was 15 years old. She holds her medical degree from the University of Pennsylvania in Philadelphia, Pennsylvania, and she completed her residency here at UCSF Benioff Children's Hospital in Oakland, where she was chief resident. So I would invite you all to welcome her to speak tonight.
Thank you so much for having me. It's meaningful that I'm from Milan because, as many of you know, the pandemic first began in China, but then Italy was the next place to be heavily hit. So this has been in my heart for over a year. I am very passionate about this topic, in part because it has completely upended my life, like everybody else's life on this call, but my professional life as a physician. I have been working closely with Oakland Unified on thinking about what would it look like to reopen safely. And so, of course, for childcare centers, this is no different. And as the vaccine has come about, the skeptic that I am by nature, I have been reading about this constantly, reading the primary literature. So today I'm excited to share with you what I have learned and hopefully answer some questions. I want to acknowledge that I had some help with these slides. Dr. Lynn Rosen from La Clínica de la Raza started putting together a lot of these slides, and then I've been putting some of my finishing touches. And then Dr. Emily Frank is both a physician at Children's and also a teacher at Oakland Unified, and we have been working together on presentations like these. So I just want to acknowledge that they helped me a lot with the slides. I want to talk to you about how the vaccine works, effectiveness, safety, side effects. Hope to answer some frequently asked questions, and then along with Dr. Vantine, answer your questions in Q&A. The vaccine is now available. There is light at the end of this dark, dark tunnel, and it is just exciting. This is from January 24th. So 2 days ago, there's actually, this website is updated daily. So as of 2 days ago, 5.6% of the US population had received at least one dose of the shot, and 1% of the population had received both. which means that a whole lot of people have already received this shot, right? Because there's what, 350 million people in this country. That means that over 3 million people have received 2 doses, and 3 times 5, is it really 15 million people have received at least 1 dose? So you will not be the first one to get this shot. Let me just tell you that. I want to start with some myth busting and then go into depth about a lot of the research. The vaccine does not have any live virus in it, okay? And I'll explain how it actually works. But because it doesn't have any live virus in it, it cannot give you COVID. It cannot cause you to test positive for COVID. It will not change your DNA, and I'll explain why in a minute. It does not contain any tracking devices. This was a rumor going around. Your cell phone that's in everybody's pocket does contain a lot of tracking devices, but the vaccine does not. It cannot give you HIV, interestingly enough. This was one of the myths and rumors that were going around. And it cannot cause sterility. That was another myth that was going around. I just wanted to start out with a little bit of myth busting before I dive into the actual literature, just because I wanted to get some things off my chest. How does it actually work? I'm a simple person, so let me tell you about how it works with Cookie Monster. So imagine that you are Cookie Monster and you like cookies very much. You like chocolate chip cookies. And COVID-19 is an M&M cookie. So Cookie Monster has never seen an M&M cookie. It kind of knows what a cookie is, just like our immune system knows what a virus is, but it's never seen COVID. It's never seen an M&M chocolate chip cookie, right? So the vaccine has the recipe for a part of the COVID virus, specifically the spike protein. It's as if it had the recipe for the M&Ms, not the whole cookie, just the M&Ms. Now, Cookie Monster, our immune system, is going to study those M&Ms. It's going to be like, oh, very interesting. If I ever meet you again, I'm going to know how to recognize you. So that if the actual M&M cookie, if the actual COVID actually comes in contact with our body, our immune system, our Cookie Monster goes, I know exactly what you are, you little naughty guy, and gets rid of it. And that's quite... It's not exactly how the immune system works, but pretty close, because actually the way the immune system works is it tags something that it recognizes as foreign with antibodies, and then there's little Pac-Man cells that go at it and eat them up. I think I just lost internet, but can you still hear me and see me? Okay. So more scientifically, hold on a second. I think I switched my view. Ay, santo Dios. Whatever, you will see my presenter view. I apologize. The vaccine actually contains mRNA, which is the recipe for the spike protein. When you're receiving that mRNA, you're actually receiving the recipe to make that spike protein. Your body's own cells are then making that protein, and they're actually mostly making it locally. So you're injected in the shoulder and the cells are taking up that vaccine. It's the cells in the muscles that make a little bit of that protein, that spike protein. Our own immune system, mostly the local immune system here, says, what the heck is this? And they take some of the spike protein and they bring it to our lymph nodes, mostly our lymph nodes under our armpit, right there. That's why some people actually feel a little lump after the injection. In here, there's a whole process that's like training ground for the immune system to recognize that spike protein and learn that that is foreign. So that again, if the whole virus, which is coded in the spike protein, ever comes in the body is able to recognize it. Why can't you share the actual COVID virus if you get the vaccine? Because by virus, you only have M&Ms in your body. You do not have the whole cookie. So there's nothing that you can shed. The vaccines that you can shed are live inactivated viruses. Vaccines like the measles, mumps, rubella vaccine or the chickenpox vaccine, where what you receive is the whole virus that's just been inactivated. It cannot cause the actual disease, but it's still live enough to where you can shed it. And even then, it's only in very specific circumstances that you should take precautions around shedding the virus. But when it comes to the COVID-19 vaccine, you cannot shed it. So there's no special precautions around being around immunocompromised people, around elderly people, because if you've gotten vaccinated, there's no way that you can be passing anything to others because of that vaccine itself. Can it modify my DNA? Great question. The answer is no, and here's why. mRNA is what you're receiving. mRNA is by definition flimsy, short-lived. We make our mRNA in our body. This is how it actually works for the genetic material in our own body. All of our cells have a bunch of DNA. And DNA is like a hardcover menu in a restaurant. It's supposed to last through lots of customers, right? It's supposed to last ourselves the hot life of the whole cell. And we use that DNA to order whatever we want. I'm hungry. I would like a really nice plate of pasta. That's DNA. And then what does the waiter do? The waiter takes your order on a little piece of flimsy paper, right? And sends it to the kitchen. We wouldn't want that piece of flimsy paper in the kitchen lasting forever. The kitchen would get completely confused and overwhelmed, right? We want that piece of mRNA to be short-lived and to do its job of saying Noemi wants pasta and then be destroyed. So, and that order of pasta never goes back to the original menu, right? Like it's not like that my ticket gets added to the menu in any way. It goes to the kitchen, they make my pasta, and then they throw it away. That is why mRNA cannot change DNA, because it's short-lived, because it's not meant to be reintegrated back into the DNA. Instead, it's just telling the body, make the spike protein, and then get out of here. The way the vaccines are administered are 2 doses. For the Pfizer, it's 3 weeks apart. For the Moderna, it's 4 weeks apart. And then you have to wait about 10 days to get to the protection that is afforded by the vaccine. And I'm going to get to that in just a minute. I just had to also bust another huge myth that is not just specific to the COVID vaccine, but to all vaccines. Do vaccines cause autism? No, they don't. There are few things in science and medicine that I get to say with the same amount of certainty as I do this one, because few things have been studied so thoroughly in so many patients over such a long period of time. If you ever want to hear the history of where this myth of autism and vaccine came about, read the story of Andrew Wakefield, former physician who's been stripped of his medical license, who was so very convinced that this was the case that he forged data. He actually went to his own son's birthday party and drew blood on the other kids at the birthday party. That's how incredibly unethical this guy was. Fudged the data. Somehow the Lancet in the 80s still published the study, then retracted it when it turned out that the data was actually really poor. But unfortunately, this started a whole chain of fear around whether vaccines cause autism. Since then, again, there's been a huge body of science that is just so irrefutable that clearly answers that question. I think it's very reasonable for a lot of people to wonder whether vaccines could cause any sort of negative thing. After all, as parents, we always are careful about making decisions because none of us want to harm our kids. None of us want to make the wrong decision. And unfortunately, there's a whole trend that is fed by some groups in the internet that feed on these parents fears and provide really false information. And I work with this every day, and I come at it from a place of any person who is questioning the safety of vaccine is coming at it from a place of wanting to make the right decisions for their children. And I understand that, and it is my job to actually read all of the studies because I took an oath to do no harm, and then share that more accurate information so that I can reassure people that No, there is no link between no causal link between vaccines and autism. And so because this I know wasn't a question that came up for me to answer in this talk, I just wanted to pause for a second and mention that. Back to COVID. Why am I so excited is that there's a COVID vaccine? Because there are diseases that we used to see all the time and we don't see anymore, except in pockets of poorly vaccinated groups. When's the last time we've seen the measles, other than in outbreaks amongst unvaccinated people? When's the last time we've seen polio? When's the last time we have seen Haemophilus meningitis? My teachers tell me horror stories of kids coming in with meningitis and pus coming out when they did the spinal tap because of Haemophilus meningitis. I've never seen it because I started my training after the vaccine came about. Vaccines, especially really effective vaccines, can eradicate disease. And talk about a disease that we really want to eradicate, like COVID. This is the moment. This is really going to be an important tool. Does it work? I mean, we're talking about this new vaccine. Does it work? It turns out, yes, it does. This is so exciting. And if you talk to me in March or April or May or June, and you were, I'm religious. I'm Catholic. I pray, I say grace, and I do my prayers. I'm sharing that about me. If you had listened to my prayers, it was, please God, make this vaccine that they're working on effective. And I had no confidence that we could be coming out of this pandemic based on people's behavior unless there was a vaccine that came about that were effective. And then this happened. 95% effective, 94.1% effective. This is really effective. This is at the level of the MMR vaccine. These are really effective vaccines. What was actually studied? What does that 95% effective mean? Effective at what? It's effective at preventing symptomatic disease. So I have COVID and I have symptoms, as well as severe disease. I have COVID and I have symptoms and they're severe enough for me to be in the hospital or otherwise incapacitated. It has not been studied. In the initial study, it has not been studied, so we don't know if it also prevents asymptomatic disease. So I have COVID and I have no symptoms, or if it prevents shedding the virus after being exposed to it, even if I've been vaccinated. Do I think that it works? Yes, because that's how vaccines work in general. And so evidence that we have from other vaccines make me feel hopeful and confident that it will work with this too. But can I claim that it does? No, I don't have the data behind it. So that is why we are going to emphasize and really emphasize ongoing wearing of masks, physical distancing, all of the other stuff in the toolbox until enough of the population has been vaccinated and our rates of positivity are so low that we can start thinking about relaxing those other layers of protection. Or if these follow-up studies that are trying to answer these exact questions tell us, we're safe, guys, it's preventing asymptomatic disease too. We don't know yet. So we can't make claims until we know for sure. And until then, we need to take adequate precautions. These are from the actual vaccine trials. So let me kind of guide you through it. This is the Pfizer trial. So there were 43,000 participants. They were 16 years and older, and they received 2 doses of a vaccine that were 3 weeks apart. So this is day 0, and half of the participants got salt water. They didn't get the vaccine, it's the placebo. And the other half got the actual vaccine, labeled here as BNT162b2. What you see here is at day 0, and for the first 2 weeks afterwards, the rates of infection are the same. And then something starts to change. And then the blue line, the placebo, continues to have an increased cumulative incidence, cumulative numbers, of COVID infections. While the vaccinated groups, look at how this line flattens out. This is how they get to that idea of 95% effectiveness. 95% is not 100, which makes sense. This is a vaccine. This is not, everything. Another reason why, until we have enough true herd immunity, we got to continue with the other layers as well. But this is amazing. What happened? Moderna, very similar curves. So it was 30,000 participants, 18 years and older, 2 doses, 4 weeks apart. And again, here you see how it's around day 14 that the curves start to differ. And then really around after the second dose, you see how they start to really diverge between the two. It was developed quickly. How do we know it's safe? So first of all, it was developed so quickly. How? Why? Well, the thing is, mRNA vaccines have been the hot topic for 20 years. They have been the future of vaccines for the past 20 years. And a lot of scientists have been working together to really figure out how to make them work. You know what was missing? Money. And you know what the government poured into this? A lot of money. And specifically, you know what they said? They said, whether it works or not, I am buying the first 100 million doses. You are guaranteed to make money out of this, right? And so, and I'm not necessarily going to give it to people if it doesn't work, but you are buffered. You're not going to lose money by pouring all of your effort, all of your people, all of your tools, all of your everything into this. We got you. To me, the COVID vaccine is the living proof that if we actually wanted to invest in eradicating disease from the world, we could. That we could eradicate malaria, that we could eradicate so many other things. Your childcare providers, we could eradicate RSV. We could probably make much better vaccines for stuff like even the flu, which we still have a pretty good vaccine. And we just heard from Dr. Vantine on this. But to me, this was the proof that anything is possible with enough support. But then I get political and I tell you how I think the government should be spending our money instead of going to war. And I'm not allowed to do that right now. So, the other reason why we were able to develop this so quickly is that it's actually much faster to develop an mRNA vaccine. This is in part why it's the future of vaccines. For the flu vaccine, for example, you actually have to grow the vaccine inside chick embryos. That's why there's a relationship with egg allergy, right? It takes a hot minute to do that. Versus with mRNA, all you got to do is use these beautiful special technology that has to make yay much mRNA and package it in a way that's stable enough. That was actually most of the research, is how do we make it stable enough for distribution? Ta-da, and you're done. So there was background knowledge, it's faster to make it, and there weren't the usual financial barriers that make stuff slow to make. But it was done pretty safely. Pretty quickly. Was it safe? Did we look at this closely enough? This was certainly one of my skeptical Noemi concerns, especially when there was a lot of politics around this. What reassured me very much is that despite pressures from the previous administration, the FDA insisted on seeing at least 2 months of safety data on all participants from each trial before moving to evaluate for vaccine safety. They said, even if this happens after your election, not our problem. We got to go through our process. That was the moment when I thought, politics hasn't infiltrated this. And then not only was there an FDA evaluation of safety, there was an independent panel of scientists, vaccine scientists, that independently reviewed the data and met for 2 days and live streamed it. There were no secrets. They were all on live stream for however many hours. And these doctors are actual, like I know one of them, Paul Offit is one of the most prolific writers when it comes to vaccine safety. And he was one of my teachers at Children's Hospital of Philadelphia. He does not live in a mansion, guys. He does not eat caviar for breakfast. He is an underpaid pediatrician who cares a whole lot about vaccine safety and gave his time to evaluate for the safety of this vaccine along with many others. So it went through all of the usual steps, and it went through the usual steps in a way that was more transparent than what was initially feared based on the narrative that was coming out of the White House around then. And then California had to do it its own way and had to do its own independent evaluation before approving it. So it's gone through another layer of evaluation for safety as well. This is the part that I love the most. If you didn't feel like 30,000 and 40,000 participants were enough to really convince you, and 30 and 40,000 participants is a lot of participants when it comes to statistics. What has been amazing is the use of this VSafe app. You sign up for it when you go to get your first shot. It's voluntary, and it checks in with you. And it checks in with you a few hours after the vaccine, and 12 hours after the vaccine, and a day after the vaccine, and the next day, and the next day, and daily for a few days, and then weekly thereafter. If you think about, maybe not all 15 million people who've gotten their first shot are participating in this. Let's say that 10% of them are participating. That's already another million people that are volunteering their information about how they're doing safety-wise. That is a lot of safety information. All of that said, I just want to recognize that as a medical community, we are working in the background of communities of color especially being wary of anything new, anything that might feel as experimental. And that is completely our fault as medicine and as medical providers because of our history. And so I definitely see that the burden is on me to earn people's trust and everybody's trust, and especially the trust of communities of color, because there's a lot of baggage that has to be undone. Especially because, as many of you may have read in the news, communities of color have been disproportionately impacted by COVID, both in terms of amount of infection as well as mortality. Is it safe to get it if I have allergies or an underlying medical condition? Great question. It's okay to get the vaccine if you have a history of a food allergy, including an egg allergy. As I explained, the egg allergy comes from the flu shot, and it comes specifically because they're harvested in chick embryos. And even then, you have to have a history of anaphylaxis to eggs, and you can still be monitored and get it. If you have an allergy to an oral medication, so penicillin allergy, whatever other allergy, still okay. Latex allergy, and anaphylaxis that's not related to anything injectable, though you want to be monitored, or a family history of anaphylaxis. You should talk to your doctor before getting this if you've had anaphylaxis to a different vaccine. And you should not get the vaccine if you have a history of a severe allergy to a component of the vaccine, or if you have a severe allergy to the first dose. That said, the story about anaphylactic reactions after the shot has been in the news, and it has led to a whole protocol of monitoring for 15 minutes after getting the vaccine. The chance of having anaphylaxis to the COVID vaccine is much lower than the chance of having anaphylaxis to MMR vaccine. And we are not counseling enough about that. I know I'm not, as a pediatrician. So I think that like a lot of other things that have to do with COVID and with the vaccine, anything that gets you to read an article and get clicks gets really amped up and played up. Not that we should know about this is important to know, but when we're thinking about that relative risk, it is actually really rare to have a true anaphylactic reaction to the vaccine. What about if you're pregnant? Well, as you can see here, while there is no data on pregnant women and the vaccine, the FDA left it up to pregnant women to decide. I don't know if you can spy with your little eye the giant belly that is featured in that picture of me. I had to ponder quite a bit about whether to go for it, knowing that I was making the decision for two. And based on everything that I have read about the vaccine and everything that I have read about COVID itself, I felt that it was safe to get it and that I was at greater risk by being exposed to COVID or my baby being exposed to COVID. Same with breastfeeding. There is no data, but like rationally, there is no reason that I can come up with not to get it. I enrolled in a study with UCSF so that I can be a part of science and I can help figure out with data whether there's any additional risk posed by the vaccine for pregnant women. So this is being studied. I think that it's a personal choice, and that if you're pregnant and you wanted to hold off on getting the vaccine, that is totally understandable. It is up to you. In fact, this whole vaccine is not compulsory. It's up to people to decide. I think it warrants a conversation with your provider so you can get all of your questions answered. And yet, I can't think of a reason why it would cause excessive risk. And I've thought about this a lot. Autoimmune disorders, immunosuppressive conditions, or on medication. These might be conditions that might impact the effectiveness of the vaccine if you're immunocompromised. What does that do to that whole Cookie Monster, looking at the M&Ms and recognizing that this is something new? Talk to your doctor. There's not enough data yet. No reason to think at this point that it would cause harm because there's no live virus, but it might not be as effective. And again, it warrants further conversation with your doctor. What are the possible side effects of the vaccine? The side effects last 1 to 2 days after the vaccine, especially after the second dose. I am getting my second dose on Thursday. I'm expecting to have a crappy day after in the following 24 to 48 hours. I'm expecting some fevers. I'm expecting some muscle aches. Still beats COVID every day of the week. Not everybody's getting these side effects, of course. My little world has a lot of doctors and nurses and healthcare providers. So all of my friends and acquaintances are getting their second dose now. Some people are saying just a sore arm again. Others are saying, oh, that was rough. I had some aches for 12 to 48 hours. No other significant safety concerns. We have at least 8 weeks of safety data from each vaccine. And I already mentioned the CDC vSafe app. In the news, I talked about anaphylaxis. As of the 29th of December, which is the last that we looked at this data, 11 people out of 4 million had anaphylaxis. That is a pretty low chance. All received medical care and recovered, but this is why we are monitoring. Bell's palsy is when you get an irritation of the seventh cranial nerve, which moves your face. 4 participants out of the 30,000 in the COVID-19 vaccine trial developed Bell's palsy. This is no different than the rate of Bell's palsy in the general population. They tend to self-resolve. So again, there are some things that we're watching out for. They don't seem to be any of the scary, dangerous stuff that a lot of people were worried about. For people who have artificial fillers, I was reading that some were getting some swelling around the artificial fillers. If you have artificial cosmetic fillers, talk to your doctor. What if you've already had COVID? Should you get it again? Yes. One, we don't know how long natural immunity lasts. And then some vaccines provide better immunity than the disease itself will provide. For example, the HPV vaccine is so good at, because it was developed in such a specific way that it is more effective at preventing cancer from HPV than having had the HPV infection. So the idea is because the immunity from the vaccine is likely to last longer and be better, because when you're getting COVID, your immune system is all awry and struggling. then the vaccine is still recommended. Also, because we're in a pandemic and our resources are strained, we simply do not have the capacity to test people to see if they still have antibodies before getting the vaccine. And so it's just not practical to do a maybe you yes, maybe you no, and let's continue to retest you. We also don't fully know how antibodies correlate with defense. So the recommendation is for everybody to get it. Anecdotally, the people that I know that had COVID and then got the vaccine got a few more side effects with that first dose as opposed to just a sore arm. Again, anecdotally, again, always beats the symptoms of COVID and the potential long-term effects of COVID. Is it okay with my religion to get the COVID vaccine? Well, based on the research that Dr. Rosen and I did, yeah, in fact, the Pope came out and said, please get it and please make sure that everybody can get it equitably. There have been other articles in the news encouraging the vaccine and with religious leaders saying that it is okay to get the vaccine from different faiths. Do I still have to wear a mask after I get the vaccine? Yes. The vaccine is one tool. It's probably the most effective tool we have had so far, but it's just one of the tools that we have to fight this pandemic. Others including physical distancing, which I know is more difficult in childcare centers. However, adults are better spreaders than children. So you're actually more at risk in the break room when you're close to each other, having lunch together with your mask off, than in the classroom when you're wearing a mask, even if the kids are running around and not tolerating the mask. Symptom screening and keeping kids home if they are sick or if there's sick contacts in the family. Staying home if you're sick. Stable cohorts. So that's the other thing. Like if you have a childcare class, that's the childcare class. There's no cross-pollinating because that just increases the risk of contacts. And then the vaccine. I just wanted to show you, this is the screening that we go through every day to get into the building at Children's. They ask us if we've been diagnosed with COVID in the past 20 days, if we live with someone who's waiting for a test. Because if you're waiting for a test, then something's up, right? And so you shouldn't take the chance and come into work. This is what I hear a lot of is we saw this family member and they didn't tell us that they had been testing and they were tested and we're waiting for results. And then the result came back positive and now I need to get tested and now I'm positive. Why didn't that person tell you? Why did they still gather? Have you had close, unprotected, no mask, closer than 6 feet for 15 minutes of longer with someone who's been diagnosed with COVID? Do you have any of these symptoms? And these symptoms are a lot of symptoms. It's not just fever, cough, and myalgias. It's also things like eye redness, runny nose. They're really broad symptoms. I know that this has meant that a lot of kids have stayed out of childcare and the parents call me and they're pissed off and they're like, well, they had one loose stool and blah, 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 blah. And I tried to explain, yeah, but we're trying to keep the whole childcare center safe. This is a team effort. And so it means that all of us are taking personal sacrifices at different points so that as a community, we can go back to having school, go back to having childcare, etc. And then there's some questions around travel, which frankly right now is not as important a risk factor because we have plenty of COVID around us. What we still don't know, we don't know how long immunity will last. We need more time. Will we need a new vaccine every year? Well, I'm going to touch on variants next, but probably we're going to need some sort of booster or updated vaccine every year. We don't know yet. Can you still spread the virus after being vaccinated? As I explained earlier, we don't know. What about new variants? So briefly about variants. Why do viruses mutate? Viruses are very simple entities. It's a shell, there's genetic material in it, and then there's some sort of like something outside of it that it works like a lock and key to get into our cells. Not fancy. What they do is they don't even have the stuff to make more copies of themselves. They rely on our cells to do it. And they have part of that genetic material in here, codes for the scribe, the copier of the genetic material, and it is sloppy. This is not highly evolved organisms. This is like the most primitive of things. So they are sloppy and they make mistakes. Specifically, when we look at COVID, it has, as I said, 3 main ingredients. It has the ingredient to make the spike, the ingredient to copy its own genetic material, and the ingredient to cut up that genetic material as needed so that the body cell can make more of it. So simple stuff. So easy to make mistakes as it's copying itself. And that's where variants come from. It's the sloppy mistakes that come from the virus making many copies of itself. For a virus to create variants, it needs people to infect. So the more we continue to have social gatherings and holiday parties and baptisms and whatever else, the more we will continue to see variants, okay? The British variant, important points, it does seem to be more contagious. We don't fully understand why yet, but the same things that decrease transmission still work. It may be associated with increased mortality. There's conflicting evidence, but it's still like yay much is like point. It's very little change. And the vaccine still provides immunity. This is fresh off the press. This is a report from the UK from just a couple of weeks ago that looked at 20,000 people. I want to point you to young children. They still are less than half as likely as adults to transmit the variant to others. And and while the secondary attack rate, so if I have this variant of COVID, what are the chances that I'll get someone else sick? While it is higher, it is not that much. It's not that much. So in the news, you'll see it is 30 to 50% higher, right? Infectivity. But what that translates to is that the secondary attack rate is 14.7% instead of 11%. So it's not as big of an absolute change. That's just the math that I have a tough time explaining. So the British variant, more contagious, perhaps a little bit more serious, but it doesn't seem to be, it's not super clear. And thankfully, the vaccine still offers good protection. The South African variant is a little bit more concerning because it does seem to be, Moderna just put out a statement, I think it was today or yesterday, that the vaccine still works, but not as well. They are studying this very hard. But it is more transmissible, and it's unclear how well the vaccine is going to continue to work. The goal is to try to prevent too much spread of this variant, and I think that the travel limitations from South Africa will be helpful, as well as the mandatory quarantining will be helpful, and increased funding for public health departments, you'll like this, Dr. Vantine, will be helpful. But we're definitely watching this. But my take-home points around the variants is they are to be expected. We're talking about viruses. Viruses mutate. The primary goal continues to be to use all of the tools at our disposal to minimize spread. The vaccine is an important tool in spreading the spread, and its efficacy may be impacted by other variants, which is why we all have to do our part with all of the other measures. The good news is that because mRNA vaccines are easy to modify, Moderna is already making a booster that's going to cover the South African variant. You know, they're already working on this. It's so much easier than making a whole new flu vaccine, which is why you got to wait a whole new year for a new type of flu vaccine, as opposed to with this is going to be much easier because of the technology. So in summary, the vaccine is safe. The vaccine is effective. It's the best tool to end the pandemic, and it's not the only tool. And thank you for your time and your attention. Sorry I talked a lot, and I'm ready for questions.
Thank you so much, Doctor. That was really, really informative. And congratulations, we saw in the picture, that we're going to have a little one. So congratulations for that. We have a few questions in the chat, so we will go through that. I think the first question is for Stephen. Why is flu vaccine not mandatory for all, especially for kids going to childcare and school settings?
Wow, boy, that's a political question in itself. We base our recommendations for which vaccines kids need, regardless of age, and adults, to the Advisory Committee on Immunization Practices, the ACIP. So they make the recommendations, and in California, we follow the recommendations, but we don't have any vaccines that are mandatory because we don't have state laws that make them mandatory, except for some vaccines that are required for school entry. Unfortunately, flu vaccine is not one of those vaccines.
Okay, thank you.
Can I add something to that? Can I
Sure.
just add something to that? As a pediatrician who's been at the front line of the efforts around vaccines, making vaccines required and make it harder for parents to opt out of vaccines for non-scientific reasons. You can hate on me for that. It is very political. And especially around the flu vaccine, there is so much emotion around this, and so much false information, so much and also really set views around the vaccine. And I am seeing the same thing start out with with the COVID vaccine. The difference is that, like, I feel like some families' hesitancy around the flu vaccine is so cemented versus this hesitancy around the COVID vaccine is still very malleable. And so I really feel that all of us who are interacting with families have a role in knowing the information and perhaps shaping the view of the COVID vaccine as being like a very positive, safe thing. I think personally, the answer to why isn't the flu vaccine mandatory is because it would have been too hard a political fight.
I think it's going to be the same for COVID. But our next question here, I think it's again for Stephen, is we are, most of us on the call are from a childcare setting, and mostly from family home childcares where a kid comes to our setting. And the question is, will another person working with children in my program be able to get the vaccine at the same time? And I'm assuming it is a family member who's living in the house with us, because since kids come to our house, our families, our kids, our spouses, or any other family member living with us is at the same risk as we are. So would they be getting the vaccine at the same time? What do you know? What's the California response for this?
Are we talking about COVID vaccine or
Yes.
influenza vaccine?
COVID.
The COVID vaccine we follow the federal guidelines, and they broke it down into a series of phases, and then each one of those phases was broke down into tiers. So we try and follow those guidelines. It's individuals that are more at risk than the average person. For instance, believe it or not, even though I work in public health, I still have not received my COVID vaccine because I do about 90% of my work from home. I am not interfacing with the public except for virtually. But my wife, however, works in an emergency department, so she's on the front line and she's already received both her doses. So unless other members of the family are at risk because of their vocation, the kind of job that they do, they probably wouldn't be eligible until we receive more vaccine and can vaccinate greater numbers of people.
So I think what the question meant was, because families come into our programs versus somebody going to a doctor's office or to a grocery store where somebody's families won't be affected. But in my case, my husband would welcome the kids and play with the kids. He's not an employee with me. He's not working full time with me, but he just interacts with the kids. So he would be at the same risk, but he's an employee at a different company, which may or may not be essential at this time for vaccine. And since we are the next in line, would he have an advantage, or would he be able to get the vaccine with me since he lives in the same house?
That would be a decision that your local health jurisdiction, your local county health department would have to make. But it's my understanding from the way that the tiers are set up that it's based on your job and relative risk. So probably not. You would get the vaccine, but he wouldn't be. It's a similar situation to my wife and I. I mean,
Yeah.
my wife's exposed on the front line every single day, and the first thing that I have her do when she gets home from work is head straight for the showers. The clothes go right in the laundry room, and she, goes in and cleans up, and then. But I'm at risk because I'm exposed to her, but because I don't have the occupational risk that she has, I'm not eligible to receive the vaccine until phase 1B, or excuse me, phase 1C, I believe I'm eligible. So unfortunately, no. Something definitely to go to your county immunization program and address that specific issue, because I know there are some variations to the theme county by county. So it'd be something we're checking into.
Okay. And the other question is to both of you, which one is better out of the 2 COVID doses that has come out in the market?
Same.
There's a
I'll
And you don't
defer
get a
to
choice.
Dr. Spinazzi.
I
I
You
think the efficacy is about the same on them. So
they're the same. The main difference between the two is that because of the way that they're stable, the Pfizer one requires some special freezers. Otherwise, they look to be about the same. I never got a choice. I signed up for a day, and that day happened to be Moderna day, and so I got Moderna. I doubt that anybody will get a choice. So good thing that they're about the same.
Okay. And I think the next question is again for you. Do we have a COVID vaccine for kids? Because that's in our setting, it's one of the questions that our parents keep asking us. Do you know if there's a vaccine for kids?
Beautiful question. We do have a vaccine. It's either the Moderna or the Pfizer vaccine. The thing is, it has only been studied for effectiveness and safety in people 16 years and older. So right now, Pfizer and Moderna are doing the follow-up studies on kids 12 to 16. The next range will be school-age kids. So I think it's 5 to 12, and then it will be the under 5. And the reason for that is that the younger you are, the more you're considered a vulnerable population. So we might have data on the 12 to 16 by the end of the summer. We might have data on the school-age kids by the end of the winter. I don't think we're gonna have data on the young kids that you take care of until 2022. That said, in all of the data that I have seen, and I am reading a lot about this, the main drivers of disease spread are the adults. So if the adults are the ones are vaccinated, even though it's an imperfect answer, right? We want the kids to get vaccinated too, but if the adults are getting vaccinated, we are creating a big barrier of protection that should significantly decrease the burden of disease.
Okay. The next question is, does being obese put me at a greater risk to experience severe COVID symptoms? I have read different reports.
Does what?
Does being obese?
I have not, does it put you at higher risk of getting side effects from the vaccines or COVID symptoms? Sorry.
COVID symptoms.
So
experience severe COVID symptoms.
Yes. So based on the studies that we have, obesity as well as diabetes, as well as hypertension, as well as older age, were linked to a greater chance of having severe symptoms, including need for hospital care. Yes, based on the data.
Okay. How long do I have to wait between taking the flu vaccine and the COVID vaccine?
I don't know.
Okay. And
Wait. Because I know that I'm supposed to get my Tdap because I'm in my 3rd trimester of pregnancy, and I think they want me to wait 4 weeks from my COVID vaccine, but I don't know if that's, maybe it's 2 weeks. I don't know. I honestly don't know. It's probably 2 to 4 weeks. It's not like, so with live virus, if it's a live virus, there's really strict rules that you cannot have any other live virus within, I think it's at least 4 weeks. This is not a live virus. I think that a lot of the answer is sort of based on common sense as opposed to like clear data and information. But I imagine that 2 to 4 weeks is probably a reasonable amount of time to wait.
Okay. Stephen, I have a question. I saw on a lot of social media sites today that California Department of Public Health has made a page where you can register when you would be in line to get a vaccine. Do you have that so we can share with people?
I don't have that link memorized because it was recently posted, but I can, excuse me, I can provide it to you and you can share it with the attendees for the.
Okay, that would be awesome. Thank you. Chandra, you have a question. You can unmute.
I just wanted to say each county also has their own link, and I think it's going to be important to register on the state website, but also make sure you register on your county's website.
Okay.
So my question is about the children getting the vaccine. So I know that kids don't have approved vaccine yet, but is it? I mean, I know you said adults are the main drivers of spreading the virus, right? But there's also a thing that kids are asymptomatic and they just pass it on. So how do you think it's going to affect, even if we adults get vaccinated? How are the kids not going to stop spreading it? Do you know?
Yeah.
Does it make sense?
So yes, it does. And when I say that kids are not the index case, what that means is that when we look at studies, one big one was done in India, another big one was done in Europe, and they look at, they did very careful public health monitoring of each case, swabbing people all around them and looking at who was the first person and how many others did they infect and who did they infect. What they found is that the primary person to get infected, even in settings where the kids were at school, was an adult. So it was usually an adult in the family that brought it home. Okay. And then the adult could give it to the kid, and then the kid could give it to someone else, but the kids are just less effective at spreading it. Kids under 9, kids under 12, they're less effective at spreading it. It is thought to be because of differences in their ACE2 receptors, differences in their ability to cough up particles. There's a lot of different theories for why, but ideally everybody would be vaccinated, children and adults. But if children are getting it from adults, then if the adults are not getting it, then much fewer kids will be getting it, which means that much fewer kids are then going to be able to give it to other kids, right? So if we are stopping it at the main source, which is the adults, then we are in turn protecting the kids. We still need to approve the vaccine for kids. We still need to protect the kids with the vaccine. But until we have certainty that it's safe and it's effective, we're not going to be doing that. That's just not how we roll. So what we have for now is at least keeping the primary bringers of COVID into each household, which are the adults, from bringing it in, so that then the kid in turn doesn't spread it to others.
Okay, thank you.
If anybody else has a question, please unmute and ask. I want to ask Stephen. Stephen, we have that app on our phones, Notify Me if I'm not wrong, which is a contact tracing app. So if it notifies you that you came in contact with someone who was positive, do you have to get a COVID test right away, or what? How does that work? And I don't know if you know this.
I'm familiar with the app, but I don't have all the specifics on the app, so I
Okay.
can get that information for you.
Yeah.
One of the things, let's back up just a second. Somebody had asked about registering. It was a good point. You should be going to your county immunization program first, because they may have local requirements for registering for getting the vaccine. But on the chat box, one of the attendees, who is also one of my colleagues that I work with, posted the website for registering to get the vaccine. It's listed in the chat box under myturn.ca.gov. So you might want to take a look at that.
I have a question about side effects. You mentioned Bell palsy. How do you know if you are susceptible to getting Bell's palsy? Is it something in your medical record that say maybe you're more sensitive, or how would you know if you can get some of these side effects? I'm concerned more about side effects.
Yeah, of course. There is no way that I know of to know that someone is susceptible to having Bell's palsy. I'm a very honest person. If I don't know something, I don't make it up. I don't think that's frank or honest. I imagine that if someone has had Bell's palsy before, there might be something about them and their immune system that reacts in that way. So if you've had it before, it might be worth having a conversation with your provider. And honestly, what they're going to say is, yeah, it's possible, but we don't really know, because we don't really know. Bell's palsy self-resolves in most cases. It's temporary, it's transient, it's a one-sided weakness of the face, temporary, and it can be treated with medication to help it get better faster. So most people get Bell's palsy without a vaccine associated with it, right? It's like they get it from being exposed to the cold or having had a virus before, or other infection. So you or I could get Bell's palsy without any vaccine, right? And without a warning and without knowing if we're predisposed to it. My cousin had Bell's palsy after going hiking in the mountains, for example. So I see Bell's palsy often, even in pediatrics, and often the trigger is a recent infection. So if we know that this is a vaccine where we might see Bell's palsy, even though it's really, really rare, what I'm going to know is that if I look at myself in the mirror and I notice that something doesn't look fully symmetric, I'm going to be calling my doctor like that. And I'm going to say, I need to be evaluated to see if I have Bell's palsy. And then I'm actually probably going to be receiving treatment for it a lot sooner than I would have if I'd gotten Bell's palsy from something else. So in a way, having the knowledge that this is a possible side effect is very empowering, because then it can help me monitor for that potential side effect, and it can empower me to really reach out to my provider if I saw it. But there's no way to really know whether you're predisposed or not. I don't know personally if a history of having had it before might be a predisposing thing. That's the only thing I can logically think of.
Okay, thank you.
So for providers who are in Alameda County or residents of Alameda County, I just posted the link where you can register yourself for the to be put on the list for vaccines. So you can check it on the chat, please.
If you have kids in your childcare centers who have Down syndrome, cerebral palsy, epilepsy, or any other similar condition where they are dependent on technology, or if you know someone personally, the Department of Developmental Services announced that their family members are considered Tier 1A. I think childcare providers are 1B. Am I correct? So if you know someone who falls into that category, so they're family members or caregivers of someone with those special needs, please let them know to really register now and seek the vaccine now. much like for kids in general, this is a really vulnerable population, and we are all doing our part by sharing that information.
So, doctor, with the schools planning to open up, and I mean, I haven't closed personally even for a day through the pandemic, when ever since it started. But with the schools closing up, the anxiety is building up. I mean, you want to send your kids to school, but there is no vaccine, and there is no guarantee that your kid would not come back with COVID. So, how would you address something like this for our parents and for ourselves as well?
I think the answer lies with what you have done in childcare centers, right? You have been doing this whole time, and you have been taking precautions, and you have been doing symptom screening. And I imagine that some childcare centers have had to close and have had to do some contact tracing and investigation, that some parents have been a little peeved when you've been a little stricter around not letting someone in with a fever or whatever else. But you've made it work. Some school districts locally, like Marin, have been open this whole time, and they've had like you can count them on the fingers in both hands how many cases they've had since March that have started from school. Districts in other places around the country have been open. The ones that have been in the news have done nonsense in like no masks and let's all mingle and all of this, and not following any of the precautions. And then of course they're in the news with huge outbreaks, because that's what gets clicks. You know what's not getting clicks? The really boring school districts that have made it work. So I think that the onus is on everybody. It's on school districts to make the schools ready to reopen safely. It's on teachers to think about how to enforce some of these safety measures, like redirecting a kid who's taken off their mask or come too close to someone else. It's on the parents to be really wise about keeping their kid home and notifying the school if the kid or a family member starts feeling sick, and promptly seeking care. It's on our public health departments to ensure that we have adequate testing available. It's on providers to continue to do what we have been doing this whole time, which is to have availability via telehealth as well as in-person care when needed, to guide families through the testing process and referring for drive-through testing and following up with results. And it's on the county and the state and the federal government to make it possible financially for families to stay home in quarantine without fearing that they're going to lose their job or lose their housing. This is a team effort, and it hasn't been a team effort until now. I think it's promising that Newsom has offered additional funding for districts that are able to reopen, because it's going to not only provide an incentive, but also the real tools to make things safer. And I think it's beautiful that organizations like childcare organizations, but also schools, are reaching out to doctors so that this is not done haphazardly, but rather done in the most scientific and safest of ways.
That's so true. With the latest news of COVID cases in kids on a rise, all my parents today were panicking because every news channel had it in their headlines that the cases are on a rise in kids specifically. I don't know if that's true, or it's just that the numbers have started coming in, or what's going on. Like all of a sudden, kids are on a rise. Where at least in California, the schools have not even opened yet in most of the counties.
Yeah.
So do you have any insight on that, any data or anything that we can actually tell our parents about?
Our cases went up in the previous 2 weeks, and then last week it just started going down, but the whole country had gone up, right? Like people gathered for Christmas and people gathered for New Year's. Could it be that some of these more transmissible variants are driving a little bit more of the cases in kids? Maybe. The data from the UK says maybe, but not by that much. The difference was like 9% secondary attack rate as opposed to 6.7%. That's not a very big difference. Again, I think that the 24-hour news cycle isn't always helping in terms of guiding people's thinking around this, because their goals is for you to stay hooked to the TV. We're all watching very carefully, and I think that the goal continues to be not to get COVID and to protect the whole community. I might come back with updated information, but at this point, I've seen it in the news much later than I've seen it in the COVID reports from a couple of weeks ago that said, "Whoa, this is a lot of cases," but then the whole country was seeing a whole lot of cases. And I'm so sorry, but I have to go because I have to go eat something because I have been working this whole time and I am pregnant and the baby is
Thank you
mad
so
at me
much,
right now.
doctor. I know we went a little overboard,
Baby's
but
hungry, you have
yeah.
to go.
Yeah, we have so many questions all the time, but thank you so much for coming in this evening.
Thank you so much.
And
For sure.
actually educating all of us.
For sure, anytime. And I know you've been recording it, and if you can share this, because I know that the questions that were from this group are the questions of a lot of people. And I thank you actually for being brave to ask some of these questions so that I could sit down and try to put something coherent together.
Thank you for answering all the questions. We will put it on a YouTube channel for our association, and then I will send you out the link so you can share it with anybody.
Thank you so
want.
much.
Thank you so much.
For sure. Bye.
Anybody has any questions about flu before we lose Stephen also?
I think a lot of parents freak out because their kid might be getting the flu and they automatically think it's COVID. You know, so understanding the difference between a flu and COVID for parents might be, you know, a re-education thing we need to do.
Yeah, and I personally, for me, every time I get a flu vaccine, I always get flu. So
I haven't yet.
It's such a nuisance, and I feel, oh, I don't want a flu vaccine until CDC says you need to have a flu vaccine to get safe. So why does this happen? Why do you get flu symptoms as soon as you get a vaccine? Is it just because we injected with a live flu virus or something?
Well, you have to understand, first of all, that there isn't any live virus in the flu vaccine with the exception of the nasal vaccine.
Oh,
so
okay.
we call those attenuated vaccines. So there's nothing in there that actually is live and would cause flu. Most of the symptoms that people feel after they receive a flu vaccine is your body's immune response being mounted against starting to develop antibodies and your body mounting that immune response. So the symptoms that you feel, you know, the achiness, the headache, you know, you might have chills or whatever, your arm is sore. I hear a lot of people complaining about their arm being sore. Those are normal reactions. True influenza, it knocks your socks off. You have a fever, feels like you've been hit by a train. You've got the cough, and it's generally a productive cough. You're really, really sick. You can't even get off the couch to go turn the channel on the TV. So there's a big difference between having real influenza. Now, that being said, that doesn't mean, yeah, exactly, your hair hurts. You know, there's so many different strains of influenza that circulate on an annual basis. Our quadrivalent vaccine only takes care of 4 of those that are circulating. So it'll reduce the symptoms. You won't be as sick. You might still get the flu. Might be another strain of the flu that you've been exposed to that you got. But there isn't anything in the flu vaccine that actually causes you to get influenza.
So then can I just double check something with you, Stephen? Because it's been my understanding that you're getting the vaccine to maybe you won't get the flu, but it's more likely that it's going to cause it to be a less severe round of getting the flu, that it's not necessarily the intent that once you're vaccinated, you won't catch the flu, but that it would hopefully be less severe. Is that accurate?
To a certain degree, yes. everybody's immune response is different. Some people are going to get the flu shot and they'll mount such an immune response, such an antibody response that they won't catch the flu if it's one of those strains that you've been exposed to. Other people might, you know, they'll mount an immune response in their bodies, but it may not be as robust as, say, I get the flu vaccine and I, you know, knock on wood, I haven't had the flu for over 30 years, thank God. Whereas we give you the same shot and you wind up with a mild case of influenza, but it's not as severe as what somebody else could get. Now, that being said, that doesn't necessarily mean that you caught one of the circulating strains of the flu that's in the flu vaccine. You may have caught one of the other strains that are out there. So it's one of those things in science and immunology that's called it depends.
Thank you.
You're welcome.
Does anybody have any other questions?
I'd just like to throw something out there. When we were talking about numbers for kids and there was some concern about that, you can always go to the CDPH website. If you go to my friend and I, Dr. Google, we get along really, really well on this one. If you type in CDPH COVID and you go to the data page and you scroll on down, it actually shows you a breakdown of the number of cases that are occurring here in California by age. And one thing that we have noticed since this began is kids under the age of 18 there's fewer cases, much fewer cases than the next age demographic, which is, and we're combining two age demographics, 18 to 60-ish is where we're seeing the majority of the cases, positive cases. So if you're ever curious about the numbers, you can always go to that website and take a look for yourself and see what's there. And I have to echo what Dr. Spinazzi was saying. You have to be really, really careful with what you hear on the news. I'm not allowed to say that they're selling sensationalism because I work for the state, so I can't say that. But you be very, very leery when you see something on the news. And you have my contact information. You can always shoot me an email and say, gosh, I heard this. What's going on with this? And I can either provide an answer for you or direct you to somebody who can answer it for you. Or I can send you a resource that you can look it up for yourself and make your own determination.
Yeah, no, that's true. But at times it's the parents who drive us crazy than we driving ourselves crazy with the news. It's the parents who have been hooked on to the TV and have all kinds of fear. So
I totally understand. One of the other comments that Dr. Spinazzi had made about if there was a tracking device in the COVID vaccine. It seems like every year once the flu vaccine is released, I get a call from a 707 area code. They want me, I've had this every year since I've been in public health. So for almost 27 years, and they want to know if there's a tracking device in the flu vaccine. And I have to tell this, and I don't know if it's the same person, but it's the same area code. And I always have to tell them, no, there's no tracking device. We have no microscopic tracking devices in the flu vaccine.
yeah, I mean, it also came out for the contact tracing app that there was a tracking device if you download the app. So a lot of my parents didn't want it to because they thought they were being tracked. And especially if you are breaking your stay-at-home orders. So you're all the more scared of doing that.
Exactly. The contact tracing app is designed so that if you've been exposed to somebody or there's somebody in your area that has been exposed and has tested positive and they're actually ill, to give you kind of a heads up. But other than that, I don't know a whole lot about it. I know I have got a lot of questions and made a lot of referrals back to our epidemiology department to have them answer those questions, because that kind of tech is out of my bailiwick, as they say.
Oh, Rebecca just posted something. Oh, that's the dashboard in the chat.
Yep. Yeah, that's where we get all of our numbers. That's set in my menu bar at the top of my computer because I look at it almost every day. So, and we're after 8:30, and I myself, even though I am not pregnant, am hungry and would like to have some supper.
Yes, so, please. Thank you so much to you and to Rebecca for staying for so long. We love talking, so we ask so many questions. This is the only
Not a
adult
problem.
interaction we have in the day, it seems.
That's what I do for this. The majority of what I do is answer questions and do presentations about infectious diseases, especially those that are vaccine related. So anytime that you want to put on one of these and you need some information, just give me a heads up. Give me, a couple of weeks so I can make sure my schedule's clear for it, but
Sure.
be more than
Sure.
happy to repeat it.
Thank you so much, and you have a good night.
You too. Have a good
Thank you.
night.
Thanks.
I like the way
you.
everybody's clapping.
Thank you, Rebecca.
Thank you.
Thank you, Shruti, for providing me the link. And this was really informative, and it was really wonderful to listen to two professionals speak so concisely and really helped address, our concerns very calmly and with a lot of respect. So thank you for providing this platform. I really appreciate it.
Thank you, Kathy, for being on the call. I was surprised when I asked you have some question and you said no. And I was like, where do I go for questions now? Nobody has questions tonight for me.
You guys are all asking them already. And I think we have so many tools, sites to go visit ourselves now.
Yes.
Well, the
Yes,
one thing
well-
I thought was weird, so like if we do daycare and our spouse is around the kids all the time, you think that they would be able to get the shot when we got the shot? Because they're around the kids.
Nancy, if what I found out from my analyst this week was if somebody in your house is on your roster, your employee roster, they are eligible for the shot. So if your spouse is on your roster,
Yeah, he is,
as a helper,
but that's not what they acted like tonight. That's not what they said
well,
tonight, though.
you have to say that they're on your roster. If you just say they live in your house, that's a different thing than they're on your
Yeah.
roster. So
Yeah,
again,
but even
I'm just
if
going to
they're
refer to
even if they're
licensing
not on
that
the
if they're on your
roster, and
roster.
even if
get a
they're not
shot.
on the roster and they just live in your house, it's like they're still in your house. They're still exposed to the kids, whether they want to be or not.
Yeah,
You go to the kitchen to get something to eat, and then you go back to the other part of the house,
I
whatever.
understand.
Thank you so much for sharing that, Kathy. That is like a good insight for all family home childcare providers, because I think one of the concerns we all share is that kids come into our houses. It's like they're coming into our home, they're coming into our personal space. It's not that they go to a center and it's just me going there. They're coming and interacting with my husband, my kids, could be my in-laws or anybody else living in my house, and they are at equal risk, because it's not that they say, 7 to 5, it's daycare hours, we will not come down. They come down, they interact with the kids. So they're at equal risk with the kids. So thank you for answering.
I did hear that about the roster anyway. I did hear that before. Yeah.
Well, and I think it's
Excellent.
another. I think it's another way, and I know you're busy, you're doing so much work, but if you've got that one parent who really wants to help, who wants to know how they can help, get that person who has advocacy skills. Get that person making sure, just drown all of our representatives, drown them with the message that the people who live in your home also help with your programs, that child care providers shouldn't be an afterthought when we think about who needs to be vaccinated. Like, find that person in your life or in your program who maybe not be helping on the floor, but would really just write letters or make phone calls. And you don't have that time, but find someone who you can give a solid message to and set them loose.
And then it seems like a lot of the people who are getting shots, they're having to go like way out of their area to get these shots, when you think they could do it in their own county. My son's girlfriend, she lives in San Ramon. She had to go all the way to San Pablo. It's like, why?
Oh,
But
Valerie.
if you can get the shot, then you know what? I'll go anywhere to get the shot.
Any Tuesday at 2 a.m.
Valerie, you have a question?
That's right, Kelly. That's right.
Yeah, let me see. I think I'm unmuted. Yeah, I have quick. I actually wanted to ask him, but I couldn't get in to do it. So kids or her. So they say kids, they aren't most likely going to get it. Well, how do they know this? Because I think a lot of my families, I do know that they wouldn't have their kids tested even if they thought they had it. They just stay home for 14 days or 10 now until the symptoms go. And there's no real testing going on because they don't want to put their children through it. Do you think that's the reason they don't think many children are spreading it or have it? Or do they actually have the facts?
Valerie, I attended a webinar with UCSF, and they said about the droplets from the children is so small, so tiny that it's not transferred as far and as quick as an adult. So it has to do with the size of the droplets.
Okay, because I'm wondering if they even know their children have COVID because they really don't, test them. There's not many parents that want to put their children through that.
Now, I just got a text
Just a
from a
little stick
provider
up the
because I
nose.
have to close.
Little stick up the nose.
Yeah, it's not too
Yeah,
fun.
but if they did have it and it was really bad, staying home for 14 days.
Well, kids